So it's nice to start with a laugh. So my name's Chris Kyndt. I'm a physician trainee. Today I've been asked by Joe to give a more personal perspective for doctors faced with inpatient issues regarding driving. And I really want to focus on the barriers that we face as doctors to making an assessment during an inpatient stay, and to highlight the point that we don't do this extremely well. And I can see a lot of OTs nodding at the doctors. I'm going to present some results of just a very, very small mini-audit, which can be extended, I hope, this year, to prove the point that we can do a lot more during patients' inpatient stay. So, as highlighted on previous talks, these are the sort of conditions that cause certain deficits key for driving. And as our role as doctors, outlined by VicRoad, is to really, during inpatient stays, to give patients firm advice regarding their possibly new diagnosis of one of these conditions and how it may affect their driving, but also to give them advice regarding informing the appropriate DLA. And very rarely do we get the opportunity to do a complete driving assessment in inpatient stay. And one of the other responsibilities we sometimes are forced to make is to actually contact the DLA directly, and that's a very rare circumstance where we may have to consider breaking confidentiality. There's a number of barriers for physicians. The reality is we don't assess driving ability in patients. Well, the doctors don't very often. Physicians lack training. These education days aren't very frequent. And in my medical training, no one has ever told me how to make a valid driving assessment. Likewise, the resources that are online are limited. So there's a 123-page VicRoad document. And for me, when I'm on a ward round and I need to give sufficient advice to patients, it's a very scary document. And the lack of quick reference resources makes it almost too hard an issue to deal with, and it's put in the too hard basket. Our time of focus as doctors is often on the acute medical illness and getting them over that. And there often is the opinion that they should be fully rehabilitated and recovered from their acute medical issues before addressing driving. Then there's the impact on the doctor-patient relationship. Well, we've already heard from Janet that there's extreme emotions linked to driving, which we must understand as doctors. And I'm often, in my experience, approached by relatives to say that they are worried about their relative and their driving capacity. And they often ask you to broach that with the patient, and you then are left with the situation of causing quite a significant worry and anxiety for that patient. And the concern is that you may well lose your sort of doctor-patient relationship if you question their ability to drive, and it's a very difficult topic to approach. Then there's the concerns regarding liability. Well, that's in two ways. The fact that you may wrongly say that someone can drive when they are able to, or on the other side, they can drive when they are clearly unable to. And then finally, the issues with breaking confidentiality. So as doctors, we have two things that often come to loggerhead. One is the private duty to protect confidentiality. The second is a public duty to warn. And this often, when I was referring to directly contacting the DLA, is the issue. So just to highlight this, I couldn't find any surveys regarding inpatient doctors and their opinions on driving assessment, but this is GPs who really are the first port of call. And this highlights the fact that they do not feel very confident at making very good driving assessments. And they also, as previously denoted, point to the fact that they have great concerns regarding the doctor-patient relationship when we bring these up, driving up. And there's a concern regarding liability. And there's a great desire for further education. I did a very quick mini-audit. I felt that when we as doctors don't really, in our social and history, take a very good driving history, I rarely have seen driving status quoted in the medical notes. It is often quoted by the OTs, as many of you might expect, but we are often the ones that are asked to fill in the notification forms, and often this happens on the last day of admission. Okay, so really I feel that we should be focusing on driving in our social history right from day one, so that at least we can try and evaluate it during the inpatient stay, or at least give significant information to the GP for follow-up. So I just looked at 20 discharges in the month of April last year. 10 were rehab patients, 10 were complex aged care patients over at the Queen Elizabeth Centre. And I wanted highly functioning patients because they would be the sort of ones that you would ask about driving. And in terms of driving history, I would expect certain questions like the following about the type of license, the type of car they drive, kilometres per day, and the activities which are linked to their driving, and their accident history to maybe be established in our medical notes. The audit showed that out of the 20 patients, the doctor's medical notes only asked about driving status in 6 patients. The 5 out of 6 of these patients were actually drivers, and only 1 history was taken that really was extensive and acknowledged recent accidents. The same batch OTs denoted driving status in 12 patients, and that left 7 drivers in total. And as you can see, these 7 drivers each had admission diagnoses which affect driving. And if you go on to have a look at secondary diagnoses, they also had 5 out of 7 had significant active medical issues that potentially affected driving. So then I looked at the amount of referrals, and there were 2 referrals that were made for driving OT assessments and clear documentation of VicRoad notification forms. But there were 5 of the drivers that had no documented advice, and there was no documentation given to the GP regarding information and follow-up, which concerns me. So, my concluding points is that we do have to start paying more attention to driving issues. I agree that the complete evaluation is probably more appropriate in an outpatient setting, but we have a role to provide GPs and follow-up specialists with appropriate information in our discharge paperwork. Documentation is key, especially in this age of liability. And there is a great need for quick reference sources, education days like these, to help clinicians respond to driving issues in practice. I'm actually on my L's. So someone said to me the other day, Dr. Chris, how can you be talking at a driving conference? But soon I'll be on my P's and feel valid. Thanks very much.